Hello, everyone. I'm Jim Longworth. Welcome to another edition of Forsyth County Connections. We're coming to you from the 5th floor of the Government Center in downtown Winston-Salem, and thank you for joining us. We have a lot on tap today. We're going to talk about a lot of different issues, and they range from talking about school health nurses to what's coming up with Festival of Lights and a lot more. But where we want to start is the very serious topic of COVID-19, and more specifically, booster shots. And we have an expert in that field with us right now. Erin Sheldon is public health nurse for the Forsyth County Department of Health. Good to see you.
Good to see you. Thanks for having me.
Thanks for doing this. I know you're busy, but let's talk about this booster situation because people get, I get confused about this stuff. Well, you get the first shot and then you get a booster. Well, there's another booster. What's changed? We hear about this new booster that's coming out. What's changed and what's different? Bring me up to speed.
Okay. So the new booster has been created to be more protective for us and to include more strains of the virus that cause severe illness and hospitalization. So the new vaccine is a bivalent vaccine, and what that means is it has virus protection against the original COVID virus from 2019 that we all came to know and have lived through. And now they have added an additional strain of the virus, and that is from the Omicron variant,
right,
which is BA4 and BA5. And the hope is that by including both of these strains, everybody in the community will have a higher level of protection from both of these.
Okay, now what does it mean now to say that I'm up to date on my vaccines and boosters? What does it mean now?
So now it means that you have completed your primary series of vaccines. You've waited 2 months at least, and you have had the new fall COVID booster, the new bivalent vaccine.
Okay. Now, of course, from the very beginning, and it's still the case, there's a lot of different manufacturers and products out there. Pfizer, Moderna, Johnson & Johnson. I remember getting a Johnson & Johnson in the beginning. You and I were talking about that off camera. Now, bring me up to speed on what products are available in terms of the new booster. Who's got it?
Okay. So the new booster is available from Moderna and Pfizer, but anybody can have the Moderna and Pfizer. You don't have to have had your primary series as a Moderna or Pfizer. So if you originally had the Novavax or you originally had a Johnson & Johnson, then you are able to have the Moderna or the Pfizer as your booster dose.
Okay, so if I got a Johnson & Johnson for the first shot, got a Moderna booster, I can get either the Pfizer or the Moderna second booster, right?
Correct.
Okay.
Correct.
Now, who's eligible for the COVID booster right now this fall? Because I remember in the very beginning when we were finally getting shots out there available, vaccines, it kind of went in stages. Well, you got to be this, or you got to be this age, you got to be this person. Mm-hmm. What about this fall? Who can get it?
So this fall, if you are over the age of 12, you can receive a booster dose as long as you have completed your primary series and it's been 2 months since your last COVID vaccine.
Well, as a health professional, let me ask you this. Who should get it? Because there are people I've heard that say, look, I'm not going to get it. Well, who should get it?
Everyone should get this vaccine unless they are not eligible because it hasn't been 2 months or they've had the primary series, or unless they have had a severe allergic to their vaccine and they have been told by their provider that they should not receive another dose.
Okay, now I'm on Medicare, so I'm not a good judge of overall what things cost anymore, but, and you know what I'm getting at. But I mean, for people that are watching this right now, they say, okay, well, I'm going to go get that new booster. Will they be charged a fee or will they go get it?
There is not a fee for the COVID boosters, and that is regardless of where they receive the vaccine, whether it's public health, whether it's a pharmacy provider, or their doctor's office.
What about if I want to get a flu vaccine and I also want to get this new booster for COVID-19, and I walk into wherever I'm getting, let's say a pharmacy, can I get them both together the same day or what?
You can get them on the same day. They will be in different arms, but this is a fantastic time to go ahead and get both of those vaccines. We're coming into early fall here. By going ahead and getting both of those doses now, your body will have time to form good immunity. So as the viruses, both flu and COVID, become more widely circulating, you will be protected as our late fall and our winter.
Okay, very quickly, we have a few seconds left. Sure. Don't want to get political. It doesn't matter what political party we're in or whatever. But the president recently said the pandemic is over. Quickly, is it?
It is not over in Forsyth County.
Okay, that's the answer I was looking for to make sure. All right, up on screen, I think we have this information, I think is the general link. Is that right? People get information?
That is correct.
Okay. Erin, thanks for doing all you're doing, and keep up the good work.
You're welcome. I enjoy it. Thanks for having me.
Thanks. We'll be right back after this.
Unlike other health concerns, mental illness is not always easy to see.
DEPR.
Mental illness doesn't show up on a scale.
Bipolar?
Sorting out a mental health concern takes professional diagnosis and treatment.
Anxiety. I thought so.
If you or a loved one has a mental health concern, don't go it alone. For 24-hour free and confidential information and treatment referral, call 1-800-662-HELP. Learn more at samhsa.gov/support.
Back now on Forsyth County Connections. I'm so glad you stayed with us. Let's talk about school nurses, because when I went to public school 150 million years ago, we had a school nurse, and she was a very important person in the school. And we have a very important person with us right now. Brooke Hamby is Public Health Nursing Supervisor for the county. Thanks for coming by.
Hey, Jim. Thanks for having me.
Let me just right off the bat, does every public school in the city-county area have a school nurse?
Every school in the Winston-Salem Forsyth County School District has a nurse assigned to them, but that doesn't mean they have a nurse in their building every day.
Now, okay, I want to get to that. Before I get to that, how would you describe the different types of nurses that work within the system that you oversee?
So we have 4 different kinds of nurses. Forsyth County government hires some nurses through the health department that are considered traditional nurses. They carry multiple school assignments. We have EC nurses that are assigned to one school that houses a large population of medically fragile, exceptional children. And then the Winston-Salem Forsyth County Schools hires school nurses in a traditional multiple school assignment, and child family support team nurses that are partnered with a case manager
Right.
and a social worker, so that they're put into schools that have more vulnerable student populations.
You know, some people think that a school nurse today just means, the school has a school nurse and she'll give out Tylenol, and that's about it. That's not right. I mean, it's pretty involved, though. What's a school nurse do?
It is. So this time of school year is the busiest time of school, the school year for the school nurses, because we're getting all new care plans in place for students that have medications or procedures that have to take place at school. We're validating immunizations and health assessments that are required by law. And that all takes place in the first 30 days of school, because on the 30th day of school, if they haven't met all the state requirements, the students are excluded from school at that point until they meet that compliance.
Are school nurses authorized to give booster shots for COVID to kids who are old enough?
So we're currently not doing any COVID vaccines in the schools. School nurses obviously can vaccinate. School nurses do vaccinate usually twice a year. In the spring and in the fall, we hold weekend clinics at the health department on Saturdays to help with our compliance numbers.
Right. Now, you sent me something in an email, and I don't have my glasses on, but I want to make sure I get this right. In the email, you said something about people talking about exclusion for non-compliant students. What does that mean?
So the state of North Carolina has laws that say that kindergartners have to have certain vaccines, 7th graders have to have a meningococcal booster, and high school seniors have to have another meningococcal vaccine. And so when students do not meet those minimums, they are excluded from school. They get the first 30 days of school to get that vaccine and be in compliance. And if they're not, then they're excluded from school, kind of like a suspension until they get that vaccine.
Okay. Now, I want to circle back to something that you were talking about at first, about the fact that, yes, there are lots of nurses, school nurses, but if you go into some schools, you're not necessarily going to find a full-time nurse in every school. As I guess that means they rotate some of them from school to school. What happens if I have a son or daughter in a school where a nurse is rotating? Maybe she isn't there that day. How are you handling this?
So that's another big role the school nurses take on in that first beginning 30 days of school. They identify students that have health needs and or procedures that might need to be taken place G-tube feedings, they may have a seizure disorder, and they identify key people in that school, first responders in that school and teachers, and they're trained on how to do those procedures and how to take care of the kids when the nurses are not there.
And I think you told me off camera that you still have some slots open for school nurses, right?
Right. I currently have vacancies through the Forsyth County Health Department for 10-month school nurses, and I have a couple vacancies for exceptional children nurses taking care of those medically fragile kids.
All right, so anybody, watching this broadcast, if you're interested, we need you if you're a nurse. Is there any particular way people can keep up with what's going on this? I know we talked about with Erin, there's a general website through Public Health. Anything else you want to tell us about where people can get more information, or if they want to say, hey, I'd like to be a nurse, or what?
So obviously, if you want to explore school nursing, you can look up the Forsyth County Human Resources page for the careers, and it's listed under public health nurse.
Okay.
And if you want more general information about school nursing, I know that when we have events and when we're doing certain special things, we usually put stuff out on our social media. The school district will put out stuff when the school nurses are doing extra activities.
All right, well, we'll look for that. Hey, Brooke, thanks for everything you're doing.
Yeah, thanks so much for having me.
All right. We'll be right back after this.
This is what too much sounds like. This is what stress feels like. And this is what help feels like. If you've lost a job, worry about your next meal, or have trouble making it through the day, we can help. Text STRESS to 211211 to find a solution.
Back now for Forsyth County Connections, and in this particular segment, we're going to talk with a gentleman who is a full-time emergency physician in the Atrium Health, Wake Forest Baptist Medical, and also helps us out here in the county as our EMS medical director. We're talking about Dr. Stephen Powell. Welcome to the show.
Thank you for having me.
I've never asked this to anybody on TV shows, but can you just give me a little answer about what a medical director is, what a medical director does?
Sure, it's confusing. I can understand that. So basically my job is medical oversight of 911 communications, EMS, and fire, and how we respond in a medical sense.
What kind of training do you have to go through to become a medical director?
Well, I start just like everybody else does. I graduate high school, and then I did 4 years of undergraduate degree studies, and then I went on to medical school for 4 additional years. I trained for 3 years as an emergency medicine doctor, and then I did a 1-year specialized training in EMS.
Now, how does we're going to call it your day job? You work with Atrium, and see all these emergency cases and serious things. How does that experience and the day-to-day things that you run into, how does that translate to your job as a medical director for the county?
Sure. Well, I mean, my job is literally an emergency medicine physician. So when our team brings a patient to the hospital, they bring them to me. And so I think that translates very well. That way I can fully understand what they're doing and then actually see what they're doing as their medical director.
There's a lot going on with not just emergency medical services, but emergency services in general in the county, 911, fire emergency, EMS, police emergencies. What kind of impact can a medical director have on all of these entities?
Well, we can have a tremendous impact. So my job is to really try to bridge the gap with what we're doing in the hospital and bring that into what we're doing in our spaces with fire and EMS to make sure that somehow that is similar, but make adjustments for what challenges we have in the field where we don't have all the beautiful things and the beautiful lights in the hospital. We have to somehow adjust that in our equipment to in the field.
How does the relationship work between what you do at Atrium and what you do with Forsyth? What kind of relationship does Atrium and the county have?
Sure. Well, the county contracts with Atrium Health, Wake Forest Baptist for a medical director, and then I interviewed for the position, and then I got the position because of my training. So that's essentially the relationship. But the benefit of that is that I'm the fellowship program director for EMS with my colleague, Dr. Nelson. I am also the EMS student elective course director for the Wake Forest School of Medicine.
Yeah.
And so those relationships allow me to kind of bridge what's cutting edge and what's new and what we're actually teaching future doctors.
You sent me an email one day about something. I want to make sure I get this right, so I'm going to look at my notes. Piedmont Regional Trauma System. What is that?
So this is a joint venture between Novant, Forsyth Medical Center, and Atrium Health, Wake Forest Baptist, where we're trying to create a cohesive system for trauma care for the people that live here. That way we're triaging and getting the people with the right people to the right place. That way they're getting the care they need.
I guess in the time remaining, since this is the first time you and I have met, I'm curious, who or what led you to have an interest in and want to pursue a career in medicine? Was it a doctor? Was it a mom, a dad, an aunt, an uncle, a teacher? How did it happen?
That's a great question. My grandmother told everybody I would be a doctor, and
Really?
eventually it just stuck.
How old were you when she went around saying that?
Oh, probably 6.
See, my mom said it and told everybody I was going to be a preacher, so I missed that mark. I mean, you hit the mark, though, and everything. So she said that, and you just sort of followed through. I mean, but you had to, at some point, you had to have some driving interest to want to pursue it, too, right?
I did. I think that it more or less came to fruition as I became a medical director when I realized the impact that I could have with the years of training and what kind of knowledge I had to really have an impact on people that live near me and around me, including my family.
All right, we have a few seconds left. We didn't rehearse any of this, but let's give people a reminder about how to use an emergency room, because you're adept at handling these emergencies of all kinds. But a lot of times you see people come in, well, I've got the flu.
Sure.
Well, I think I might have a sprain, but I don't know. When should somebody use the emergency room?
It's a challenge. It's a challenge because of our current healthcare system. If you feel that you're having an emergency, you should go to the emergency room. If it's not an emergency, then there are potentially better places, such as your primary doctor's office or an urgent care. But it's hard because sometimes people don't know that they're having an emergency or not, and that's why they come there. They want our advice, and so it is a challenge. But if you think you're having an emergency, you should go there.
Yeah, having chest pains or
Sure.
something. I mean,
Yes, sir.
don't fool around with it.
Absolutely.
Hey, Doc, thanks for doing this. I hope you'll come back and see us sometime.
Thank you for having me here.
All right. We'll be right back after this.
What do you think you're doing, Kevin?
Was just gonna drive home.
There are several warning signs present that you shouldn't be driving.
Like hearing voices?
Like your text-to-emoji ratio?
Oh man, the selfies. Selfie, nailed it.
We all have warning signs that let us know that we're probably not okay to drive. Mine is pretending to be your subconscious.
Craig, come on man, let's split a ride home.
Back now on Forsyth County Connections. So glad you stayed with us. We have a very special guest with us. He has a storied career in helping folks, and you're going to see why as we talk about it. With me right now is Chris Davis. He's president of North Carolina State Firefighters Association and the Forsyth County Fire Chiefs Association. Retired from the county many years in this field, and we're so glad to have you here, Chris. Thanks.
Thanks, sir. Appreciate you.
Help me understand something. Do most cities and counties have paid or volunteer fire departments, or are they a combination of both, or what?
Most of it's a combination. Most of the municipalities, however, are strictly career firefighters, but the surrounding suburban or rural areas, they're mostly either volunteer or combination departments.
So what about Forsyth County? How's it work?
So Winston-Salem and Kernersville, they're the two big municipalities in Forsyth County, and they are career staffed. The other volunteer departments or the rural departments in Forsyth County, they are a combination department where they have paid people or paid staff, and they're supplemented by volunteers.
All right, now, Chris, let's talk about the volunteer departments, because you mentioned rural areas and whatever, and I live in Forsyth, so help me understand what are some of the areas that volunteer fire departments serve? If you go around and see a different fire station for whatever, how many of those do you have? Who do they serve?
So there's 16 departments in Forsyth County. That does include Winston-Salem and Kernersville, so there are 14 volunteer departments, volunteer fire departments in Forsyth County.
Are you still in need of volunteers?
Absolutely. We're losing volunteers every year. The number keeps declining. And so the need for volunteers is great.
Well, now, if somebody says, I'd like to volunteer, but I don't think I've got the right stuff to fight fires, is there something else I can volunteer for, Chris?
Absolutely. You don't have to be a volunteer firefighter to be a volunteer for the fire department. There's plenty of other things to do for the fire department, such as public education, checking smoke alarms, getting out visiting with the community, just to let them know that we're there and we're there to help and support the community.
Now, you mentioned that there is a shortage of including volunteer firefighters.
Yes.
What are you doing? I know I'm putting you on the spot, but what are you doing to address that shortage?
So there's a lot of recruitment and retention programs going on, not only in Forsyth County, but also statewide. There's a lot in Forsyth County that's gotten grants over the past several years to help sustain or try to entice or recruit the volunteers to be volunteer firefighters. And we've had some marginal success in that. It hasn't been one of those programs to where it's just been so great. It's a struggle. It's a struggle to get folks that want to volunteer or want to do something for their community.
All right, let's say I'm coming out of high school, maybe in college or whatever, and I say, look, I've always wanted to be a firefighter. Now, does that person have to go to a community college or somewhere to get special training or X number of hours on a course, or how does that work?
So currently we have 3 high schools that have fire programs in them. One is Walkertown High, Glen High, and we just started one at West Forsyth High School. So you have high schoolers that are getting educated or trained in the fire service before they even graduate. If they graduate and they want to become a firefighter, then they can absolutely go to a local community college and get their training there, or they can join a fire department and the fire department can help them get their training.
We've been lucky to have you as part of the firefighting family for so many years. How long have you been at it?
I started when I was 13 years old, so I've been at it for about 39 years.
I was getting to think. I was hoping you weren't going to say you started fires at 13.
No, sir.
No,
no, sir.
You started an interest in that,
yep.
And you volunteered and all sorts of stuff. What led you to be interested in a career like that? I'm just curious.
So the career part of it was kind of strange. I thought I was going to be a dairy farmer, but our family sold the farm, so I was already a junior firefighter in Clemens Fire Department.
Right.
And so I wanted to do something that changed every day, something that you didn't go in and it wasn't monotonous. So that fire department just fit that need, and I've never looked back since.
Well, we appreciate that you didn't look back and that you stayed with it, and now running these associations and keeping track of everything and helping out. I know before we got a few seconds left. Is there a particular website or phone number or something people call, say if they're interested in volunteering?
Absolutely. ForsythFirefighters.com. They can go on there. They can get information. They can submit information to get to the fire departments that they would volunteer at.
Right.
Or they can stop in and visit any local fire department, and they'd be glad to talk to them and help them out.
I'll just go into one of them and tell them I know you.
Absolutely.
What'll that get me?
Well, if it's on a Tuesday, you'll get spaghetti.
Hey, Chris, thanks for all you do.
Absolutely.
Man. All right. We'll be right back after this.
Every year, 4.5 million young adults between the ages of 18 and 24 visit the ER.
It's every parent's nightmare.
Umergency gives you all the tools you need to quickly and effectively manage your family's emergency. Umergency provides instant access to vital resources, customized to your student's campus and local community, digital consent form, and built-in urgent alert button. Umergency gives you peace of mind when you need it most. Download your Umergency app now.
Back now on our final segment of the program here on Forsyth County Connections. I'm glad you stayed with us. You'll be glad you did too, because we're talking about big things coming up, including Festival of Lights. We'll check in and see how we're doing with that and all sorts of things with an expert in the field, Amy Fleet's Marketing and Events Manager for Forsyth County. Thanks for being here.
Thanks for having me.
Now, we talked about this off camera. So on camera, I'll officially ask you, how long have you worked for the county?
Well, almost 6 months now, so I'm still learning all the county ways.
All right. Now, where's your office? Is it based out of or near Tanglewood? Or?
So while I manage all of the 9 county parks, my office is at Tanglewood Park. So I work there with 3 other event planners, and we work to reserve all the shelters in Tanglewood Park and then all the indoor facilities there.
Yeah, I have. As a little boy, I had fond memories of going and fishing and doing paddle boats and stuff at Tanglewood. It's been a storied place to go to now, and still is, and even better. What type of events can we look for this fall?
So lots of things are happening. This weekend coming up, we have Tour de Tanglewood, which is a bike race, and I'm told that's an annual race that we host.
Right.
So all those proceeds go to the MS, the local chapter there. And then coming up, our next big event will be Southern Charm at the Farm. It's a mouthful. We host a show for them in the spring, and then we also host our fall show. It is over 250 vendors. It's food trucks. It's live music.
Wow.
Brings thousands of people to the park. It's a big event for us, and it's down in the concert shell area of Tanglewood.
So music, is that the one where I was reading about, or maybe you sent me something one day as a hayride or something? Are you gonna?
Yeah, so also our Tanglewood stables, they stay pretty busy, not only doing horseback riding lessons and so forth, but they also do a special fall hayride, and it's a secret pumpkin patch. Even I don't know where the pumpkin patch is at, but when you go and participate in that, you get to pick your own pumpkin and take it home with you. So
Wow.
they stay pretty busy at the stables.
That's cool. Now tell me again when the big all the vendors are going to be out there. When is that again?
So that is Saturday, October the 8th, is Southern Charm at the farm.
Now, is there any? I know I'm putting you on the spot. We didn't rehearse this or anything. Do you have to, as you approach the area for this big deal, are you gonna? Do I need to pay for to get in, or what's the deal?
So when you arrive for Southern Charm, the parking is free. You'll park in the steeplechase area, and then it is a ticketed event, and you can visit Southern Charm. They have a website, they have social media that you can purchase your tickets in advance or purchase the day of.
All right. Now I know that it's a lot of people think it's a long way off for Christmas, but it's not really the holiday season. So give me a sort of an update on where we stand with Festival of Lights.
Festival of Lights, it's our big event. It's the 31st season, and it's sponsored by Lowe's Foods again this year. Pretty excited about it. This is my first season with it, and I'll get to watch our maintenance team right now. They've been putting up the light displays since August.
Right.
And so if you went to Tanglewood Park right now, you're going to see all kinds of displays, and it's beginning to look a lot like Christmas there. So yeah, that's coming up very soon. We've got an opening day of Friday, November the 11th.
And then it'll run through when?
It goes through New Year's Day, January 1st. That's our last night of the show.
All right. Now, we talked about a minute ago about admission and various tickets and things to the other thing for this fall. But if you're going to Festival of Lights, is this the kind of thing where you need to get tickets way in advance, or how does that work?
So you can purchase advance tickets in our marketing events office and at the Welcome Center. You can also purchase the annual exclusive ornaments for Festival of Lights. So you can get those starting October the 1st. So if you want to go ahead and get your tickets or even buy an ornament, you can do so early before the show starts.
Now, give me some inside information here. As they say, are there certain days that are better to go, that are less congested, or what's your advice as we get nearer to the opening of Festival of Lights?
Definitely. It's a popular show, and we can see long waits. So my advice would be to visit on a Monday, Tuesday, Wednesday, or Thursday.
Gotcha.
Kind of avoid those weekends because there will be waits on the weekends.
It's going to be packed. Well, it should be packed because, I mean, it's a great thing. Now, before we lose time, is there a website that people can learn more about what's going on with Festival of Lights and other stuff?
Sure. If you visit the county's website and go to departments and Parks and Recreation, you can go to Tanglewood Park, and Festival of Lights has its own website, so you can go and visit and get all the information, or follow us on social media.
Well, Amy, I appreciate you doing this. And speaking of websites, folks at home, you've noticed it up behind us throughout the show. It's connectwith.forsythcountync.gov. That's a general website, too, you can go to find out more about what we're doing. And speaking of this television show, we couldn't do it without the help of Tracy Doyle, who puts it all together, and, of course, our executive producer, who also happens to be County Manager Dudley Watts, for helping us pick out the topics and help with the coordination. So a lot of good folks working on this program. Amy, again, thanks for doing this.
Thank you for having me, Jim.
And we'll see you on the next edition of Forsyth County Connections.